And to be honest, like she went to see the surgeon and the surgeon said everything looks great. And honestly, I'd have to agree. Nothing looked bad about it, but it's not just all about the look, it's about the function. Because if she doesn't get that scar tissue and that fascia working again, getting it mobile and gliding, she risks over time that yes, her breasts will look beautiful and be nice and balanced with her body, but her posture is getting pulled into them and she's not going to be able to stand tall in that posture and being able to just stand balanced. Hi, I'm Lianne Balazsi, osteopath, mom, and lifelong student of how the body truly heals. With backgrounds in psychology, athletic therapy, and occupational therapy, I've spent over a decade helping women cut through the noise of the wellness world to get back to feeling like themselves again. Strong, clear, and grounded. Here we explore the physical, mental, and spiritual sides of well-being so you can realign your energy, restore your rhythm, and reinvent your life from the inside out. This is the Holistish Podcast. Before we dive in, a quick reminder. I'm an osteopath, not a medical doctor, and this podcast is for informational purposes only. The content shared here is based on my personal experience in education in health and holistic wellness. It is not a substitute for professional medical advice, diagnosis, or treatment. Always consult a qualified healthcare provider with any questions you may have about your own particular situation and your health. Okay, now that we got that out of the way, let's get on with the show. Ladies, I feel like there's something we need to talk about. Because this is a zone, as an osteopath, that not many will talk about. And most people will probably think that this zone has zero impact on your posture. But there are a lot of women out there who would beg to differ, and yet they don't always get the support they need. So one zone that started becoming prominent in my experience, let's say, from the time that I was a student, this theme kept popping up for me. It was a lesson I needed to learn. Basically, I don't know why, but in my class, any woman in the student clinic who came to get treatment when we were learning and we had supervisors who were guiding us along, I had a recurring theme in my clientele that I don't understand why I was picked for this, but women who had issues with their breast tissue or having implants or had a breast cancer, women with issues around breasts and the fascia of the breasts kept coming to me. And I ended up having to do at the end of clinic, most days we always had a roundup of the day and one of the most biggest takeaway stories had to present. And it became a recurring gag. At the end of my student life there, I think I presented 4 times on the response of the breast tissue in the body. It's like no one else really seemed to understand why it always fell on me. And it was different people who would come and see me. And this kind of continued on into my clinical practice over the years where it's not like I have a reputation for this, but there would always be some interesting cases around women's breasts that would end up on my table. So buckle up if you want to hear stories of how the state of quality of tissue of the breasts or having surgery at your breasts can have an impact on your posture. Listen up. This is an interesting one. I have a few different case stories I wanted to share and show how basically we cannot ignore this zone anymore. It's not just part of you and it has no purpose. It actually does play a role in how you carry yourself in gravity. So, where to begin? I can start with my very first ever case study around breast tissue. So, I was possibly in my 3rd or 4th year in school, and I had a woman who came to the student clinic, and she had been diagnosed with breast cancer, unfortunately. And then she chose to only have one breast removed, the breast with the cancer that was obviously in it. And she kept her other breast. So she walked around with kind of one breast filling her bra and the other one was empty. But she kept having recurring issues in her neck and in between her shoulder blades. And she thought it was something where we just had to crack a vertebrae back into place and she'd be good to go. But as I was questioning her more before even knowing any of this stuff around her surgeries, I had asked her, so it's a standard question because we need to know about scar tissue and the impact around the body. And I asked her, so have you had any surgeries? And she replied, well, yes, I had one breast removed because of breast cancer. And I said, well, how long ago was that? And she said, oh, it's only been a couple of months, but that has nothing to do with my neck and my shoulder pain. And that's where I step out of the room. I go talk to my supervisor. I explain what's up. And she basically told me, guess what you're doing today? And I was like, please don't make me touch women's breasts. And she said, well, you have to treat the scars. So I returned back in. I explained the situation to her. She was not necessarily the most excited about the procedure, but she obviously was like, okay, like I'm here and I'm open. You know, if you're an osteopath listening to this and this becomes something that comes up in your practice, you really have to make sure you explain how the impact of scar tissue can pull on someone's fascia and then pull into the structure, which then can pull your person out of gravity. So we did all that explanation, and then I moved on to, you don't just jump on the zone. You have to prepare. You make sure everything else is clear in the checklist of how we do our procedure. But when it was time to work on the scars, that's what we did. And we just do the standard treatment of scars that I learned. And, it was really amazing in the sense of how much different her body presented after clearing those scars and getting them a bit more mobile. And then the difference she felt after the treatment when she stood up from the table and how she was actually able to pull her shoulders back more and have her head sit better on her shoulders because she wasn't being pulled forward into all that scar tissue. So she was really apprehensive at first. But then in the end, when she understood the power of how the scar tissue can really pull on your fascia, especially around the chest, which then pulls into your neck and your head, she was ecstatic. And she came back a few more times because on the side where she had her breast removed, there was more scar tissue and it was pulling into her left shoulder. It was her left breast that was removed and her left shoulder get being pulled forward and down into that area. So we had to do a bit more work on that side over time in order to help things get opened up more in her shoulders so that she could finally relax her shoulder, but also have less friction in her shoulder joint. Because, she would go to see other people and say, my shoulder hurts. And all they would do is work on the shoulder, but they would ignore the fact that she had that whole fascial pull into the scar tissue. So once again, I will die on this hill saying you have to address the root cause first before you can actually get the result that you want. So if you keep repeating the same things over and over again on someone, or if you're a patient and you're getting the same treatment over and over again and you're getting zero result, you really need to have an honest conversation with your osteopath, your physio, even, your doctor if he does manual therapy. You need to be able to openly say, look, we're doing the same thing over and over again and it's not working. Could it be coming from somewhere else? And most of the time, it really is. So she came back until she had little tweaks to do this patient for a couple of years. I was in my third year when I met her, and I had another year and a half in my schooling at the external clinic before I graduated, and then moved on to my thesis where I did more clinical work. So she actually followed me up until I graduated from the undergrad levels. And she was very appreciative, and honestly, it helped her just to get back to an active lifestyle and be able to lift weights again pain-free and to help then start reinforcing her back muscles in order to improve her posture. So it sounds silly when you say it right up front of work on breast tissue and then everything unlocks. But for this one person in particular, that's really what happened. Quick pause for a second. I just wanted to take a moment to say if this material is resonating with you, I would love for you to come and join my free community over on School. That's SKOOL.com. The group I have is called Ask the Osteopath, and we talk about all different types of topics around your health and well-being. Yes, there's foundations in osteopathy, but we keep it to a broader range all around holistic health and wellness in order to optimize your everyday well-being. So if this sounds like a place you'd like to be, I invite you to go to school.com/osteo. And now, back to the episode. It kind of segues into another scenario where not long after I graduated and I started working in clinic, I had someone who I met for the very first time, and she had just gotten a breast augmentation surgery. And hey, no judgment whatsoever on women who choose to do that. Like, I can totally get it. It's not my place to judge or say it's a bad thing. All I know is sometimes the impact of the surgery and the implant and the inflammation that can come from the healing around the implant and the scar tissue can actually pull you into a bad posture. I saw 2 patients actually in the past few years who had breast augmentation, and they ended up having 2 different kinds of problems around their breast augmentation surgery. One of them, she got the surgery done. She was super happy with it, still happy with it to this day, but she actually had one implant that stayed stuck high while the other one dropped. So after the surgery is done, they may start off a little high, but over time they do drop into like the position that they will remain in for the remainder of their stay in your body. And in this one patient in particular, she had one implant that dropped and one that didn't. And it was causing her so much discomfort, so much pain. And the skin around looked swollen, inflamed, like it was sensitive to the touch. Honestly, I felt really bad for her. It really did not look like a pleasant experience. So, I try to understand what's going on with her, and she wasn't necessarily coming for me to work on her boobs, but she was aware that osteopathy could possibly help or support in a way. But I don't know if she expected it in the way that I had to propose it to her. Because, after you have a few years of experience, you're able to explain these possibly uncomfortable situations better. And this one woman, she was kind of like, look, whatever you got to do, just do it. So I was really appreciative of her openness to this, because what it came down to was the scars themselves were not that bad. We still had to work the scar tissue. But what really stood out to me was that there was some inflammation around that one implant that wouldn't drop. And then the implant itself got stuck somehow in the tissue. So in the layers of skin to fascia, muscle, right down to the implant. So it's as if between all those layers of tissue, the implant wasn't free to glide enough to then finally slide down into the place that it needed to go. So what I had to do was I had to basically cup the implant, put my hands around it, and just kind of start working it and trying to see which way it'll unlock in order to find the proper position. So when you're someone brand new, and this was a brand new patient, you're trying to keep things light, but this is what the person needs. So you're just basically on someone's chest for a half hour. It's when you look back on it, you're like, it can be quite silly and it makes for good stories. But at the same time, it's really amazing when it can seem so awkward or uncomfortable at first. But the amount of relief it gave her at the end of the treatment is really worth all that discomfort, because she was able to get off from the table and already we could see that the implant started to drop and be more even with the other. It didn't fully drop, but then over the next few days, as her body integrated what we had done, it ended up dropping fully. And then she had so much relief and less discomfort in her tissues and less swelling. And she returned to her surgeon to double check everything. And he said everything looked great after. So it's just fascinating to see how the body can react sometimes. It doesn't mean necessarily that the surgeon did something wrong or that the body is off. It's just sometimes little unexpected snags can happen. And then once you know the right person who can come and help you set the right tools, it can be really, really fun to get those results for someone and make them avoid maybe a second surgery or what have you. So the other person who I saw who had a breast augmentation surgery, it wasn't necessarily that nothing dropped or nothing that it didn't work. It was more her reasoning of why she wanted to get a breast augmentation in the first place. I remember her telling me she had a bit of a curve in her upper back, like she was as if she was very hunched over already. So even though she her words, felt like she didn't have a very big chest. It's as if she still kind of curved forward almost to hide the fact that she didn't have a big chest, or she just had a bad posture from her work. I remember she worked as an esthetician, so she was bent over a lot and curved over her clients and everything. So she thought maybe by having things balance out with an augmentation, it would help her straighten out her posture better and then help her feel more of a balanced look. But what she actually revealed to me after was that, oh my goodness, like I thought this would balance me out, and if anything, it's just accentuating my hunched back further. And she got very discouraged by it. It gave her neck issues. It gave her upper dorsal issues. She had pain across her shoulder blades. And what's funny is maybe if she hadn't gotten the breast augmentation in the first place, I could have gone more straight to the structure and worked if she had any vertebrae off or what have you. Maybe she had more diaphragm issues. But what I actually had to address first, because this was the latest primary cause in this layer that her body was showing me, I actually had to go to her breast implants and work on the scar tissue that was associated with the surgery she had. Even if the surgery was already a few years old, like the scars were healed, there was no big inflammation there, but the scar tissue itself was pulling on the fascia even more, so that she really couldn't even try to fight against the implants to stand straight, because the implants had pulled so much on her fascia through the scarring. So we worked on the implants, and again, what I had to do with that particular case was not just one implant like I did with the other case. I had to work both of them in order to really get as much mobility, as much freedom and gliding between all the different layers as possible, so that she could start to finally be able to push her shoulders back. And then once that was cleared, or we felt like we had a good enough mobility to go forward, then we were able to work more on her structure and her diaphragm and like freeing up her neck. But it's as if she added a whole other layer of complexity by getting the implants after she already had issues in the first place. So I just want to be mindful and say I'm not actually saying that the breast implants are always going to cause problems for people, and I'm not discouraging anyone from getting them if that's what they choose to do. Again, hey, it's a free world. I have zero judgment. I'm just bringing this stuff forward so that we can be wise and knowledgeable of, if this starts to happen to you, that you can get the proper support you need in order to free up your mobility. Because the last thing we want is you go and get a procedure in order to help boost your confidence, to make you feel balanced in your body, or to give better proportions. The last thing I would want is that after, it starts causing you more problems in a different way, and then it just, feeds the fire of not feeling good in your body. So another case I can give you that was also related to breast surgery was a woman actually who she had also a breast cancer, but she did a different kind of procedure. She actually instead of getting implants, because she wanted to avoid she didn't want to have no breasts at all, but she didn't want to have implants. She had read up a lot on breast implant illness, so she vouched for getting a fat transfer instead. So she basically took fat deposits, not that she was an overweight person, but just enough from different areas of her body, which gave her a bit of a tummy tuck. And she transferred some of that into where her breasts used to be in order to reshape everything to be a little more proportioned. She came to me and she had discomfort around her breasts. But on top of that, she felt like her whole torso was in a corset. So they had taken around her, maybe some extra belly fat she had around her hips, her thighs, but more in the front, around her belly. And they transferred it, but then the consistency of the tissue in her breast area it felt like it was oatmeal in a plastic bag that you pull super, super tight. So it was almost like it was making all this like tight, lumpy crumbles. And I'm not saying everyone who gets that will have that feeling, but it's almost like her fascia got pulled too tight when she got sewn at the end of her procedure. And not trying to insult the surgeon who did it either. Like, it's possible this is just the way she reacted, and that's that. We never know fully how someone's going to react. So we had to release the breast tissue that way, kind of the same way I worked with the implant, trying to really get a bit of a harmony, because the breast tissue have a rhythm of movement to them. When you're breathing in and out, your whole body does an opening movement. It's very subtle, but everything moves into an expansion as you breathe in order to let the air into your lungs and lower your diaphragm. And then as you exhale, everything goes in the opposite direction. So funny enough, the breast tissue have their own little movement like that. And I had to work a while to get that movement restored so that every time she breathes, she doesn't feel restricted by her breast tissue not wanting to move. But then on top of it, I had to go and work where she had that tummy tuck done, because that corset she was describing was actually, when they went to re-sew her, she felt, in her opinion, it was too tight. But I'll be honest, from an aesthetic look, she looked snatched. Like, she looked super tight. It looked like she worked out 6 days a week and everything. But she was literally saying, like, I'm trying to breathe deeply and I can't breathe. So we had to go work all the scar tissue around her abdomen, really try to get everything gliding a bit better. And then lo and behold, she was so happy. I didn't see her again after. Like, I haven't seen her since. That was maybe 5 years ago that I saw her. And it just opened my eyes every time. Like, I was starting to stack all these experiences with women around breast tissue and scar tissue around your breasts. And it really is a central area that can pull from all different directions into your body. Last but not least, I have another one, which is actually another scenario, which is a woman who got breast reduction surgery. And she's someone where, honestly, like, everyone's got their choices in life and there's no judgment. That she really felt like she needed to, scale it back a bit. And she was very happy with the surgery. Everything went great. She was super satisfied. But she was starting to feel, as she was healing from her surgery, that she was actually getting pulled into her scars. Like, her shoulders were starting to pull into the scar tissue around her breasts. So she came to see me, and because she's, someone I've seen before, and I've loosely talked about the effect of scar tissue. So when she had this surgery, she was like, right, I should go see Lianne. So she comes and I start, just feeling around where the scar tissue is. And it was so tight. It really felt like, on the surface, the scars looked amazing. Like, you wouldn't know that there was any pulling going on. It's very subtle. But it's as if when you get in contact with the scar, it's as if there was a vortex pulling down, down, down to where the surgical site happened underneath the skin, right where the breast tissue was removed. So everything was pulling down towards those sites. And it ends up pulling into your shoulders. She felt like she couldn't pull her shoulders back. It was going right into the breast tissue, goes right into your armpits, basically. And she was feeling it down along the side of her ribs, right under her arm. She was saying it was quite unpleasant. So we started getting to work with that. And actually, by the end of the session, I felt like things were gliding better. But she had quite a bit of tension there, despite everything looking really, really, really good. And to be honest, like, she went to see the surgeon, and the surgeon said everything looks great. And honestly, I'd have to agree. Nothing looked bad about it, but it's not just all about the look, it's about the function. Because if she doesn't get that scar tissue and that fascia working again, getting it mobile and gliding, she risks over time that, yes, her breasts will look beautiful and be nice and balanced with her body, but her posture is getting pulled into them, and she's not going to be able to stand tall in that posture and being able to just stand balanced, which was the whole reason why she had the breast reduction in the first place. She's going to end up going back into a more of a crouch position and causing more neck issues and headaches. And, she's someone who likes to bike. It's just going to add more and more pressure into the system instead of allowing her to have the posture she's always been craving. It's really fascinating to see how, something that could be seen more as just a sign of femininity can actually have a function itself. Aside from, yes, it's there for when we bear children and if you choose to breastfeed, but just as a functional anatomy standpoint, the breast tissue does have a role to play. If you choose to get surgery of any kind, there will be some consequences. Funny enough, it brings me to another story of a breast reduction, but this time it was actually a patient of mine who decided to transition from biological female to male, and they ended up having their breasts fully removed. And this is an example of someone actually who was very conscious of this. We had talked about it before the surgery happened and how it can have an impact. And they were so conscious about that aspect that they took a lot of personal measures into hand where they were mindful of their movement. They were mindful of doing stretching. They were very mindful of the procedure and the maintenance that they needed to do after a surgery in order to prevent so much pulling of the scar tissue. And funny enough, when they came back to see me, I said, give it about 6 weeks before we start playing around with scar tissue. And when they came back, honestly, I did not feel much of a pull there because they were already doing so many steps in their everyday life in order to help keep stretching and expanding it as it was indicated to do so. And it's possible that everyone's physiology is a little different this way. It doesn't mean like if you do all the stretches and it still pulls that you did something wrong or there's something wrong with you. It's possible this person's anatomy, physiology, and just the elements that they were implementing just lined up better that once they had the surgery, it didn't have that much of an impact on them. Whereas others who could be doing almost all the same things, they get more pull. I think it all depends on how your body heals in these situations. So all this to say, breast tissue itself is there to, show your femininity, but we have to be mindful of also, this is another part of your body that can pull and play on your structure's integrity. So I hope I leave you with this message saying, take care of your body will take care of you, and be mindful if you're getting any surgeries there, you may need to get some scar tissue looked over in order to prevent any postural issues in the future. Thanks for tuning in to the Holistish podcast. If this episode helped you see your health or your life in a new light, I'd love for you to share it with a friend. Or tag me on Instagram at the.holistish so we can spread the message that healing isn't all or nothing. It's holistic-ish. Until next time, keep listening to your body, leading with curiosity, and living in alignment from the inside out.